Coronary heart disease. Coronary heart disease, also called as atherosclerotic heart disease. Coronary artery disease is the narrowing or blockage of the coronary arteries, usually caused by atherosclerosis. Atherosclerosis is the buildup of fat, cholesterol, calcium, and other substances found in the blood on the inner walls of the arteries. When plaque builds up, it narrows the coronary arteries, decreasing blood flow to the heart. Without an adequate blood supply, the heart becomes starved of oxygen and the vital nutrients it needs to work properly. The decreased blood flow may cause chest pain, shortness of breath, and other coronary artery disease signs and symptoms. A complete blockage can cause a heart attack. Coronary artery disease, also called ischemic heart disease, is the term given to heart problems caused by narrowed heart arteries that supply blood to the heart muscle. Ischemic means that an organ is not getting enough blood and oxygen. Causes. Coronary artery disease may be caused by various factors. Older age increases your risk of damaged and narrowed arteries, especially after age 65. Men are generally at greater risk of coronary artery disease. A family history of heart disease is associated with a higher risk of coronary artery disease. If you have a parent or first degree relative with a history of heart disease, especially if they were diagnosed before age 50, cigarette smoking and exposure to tobacco smoke can increase the risk of coronary artery disease. High blood cholesterol, high blood pressure, and uncontrolled diabetes can increase the risk of formation of plaque. Overweight or obesity, physical inactivity worsens risk factors. Uncontrolled stress, unhealthy diet, and sedentary lifestyle contribute to coronary artery disease. Some of the other possible factors of coronary artery disease include sleep apnea, alcohol use, high triglycerides, and preeclampsia. Symptoms. One common symptom of coronary artery disease is a type of chest pain called angina. Angina may feel like pain, discomfort, pressure, tightness, numbness, or burning sensation in the chest, arms, shoulders, back, upper abdomen, or jaw. It can also feel like fullness or squeezing, usually occurs on the middle or left side of the chest. Angina is generally triggered by physical or emotional stress. The pain usually goes away within minutes after stopping the stressful activity. Other symptoms include shortness of breath and a heart attack. The following symptoms can be signs of either angina or the onset of a heart attack caused by underlying coronary artery disease. Pain, discomfort, pressure, numbness, burning sensation in the chest, arm, shoulder, back, upper abdomen or jaw. Dizziness, weakness, nausea, vomiting, indigestion, sweating, rapid heartbeat or palpitations, anxiety and a general feeling of being unwell. How do you know if you are experiencing angina or a heart attack? Angina and a heart attack, both of these conditions can involve chest pain and other similar symptoms. However, if the pain varies in quality, lasts more than 15 minutes, or doesn't respond to the nitroglycerin tablets, then it's possible that you are having a heart attack and you need to seek medical help immediately. Angina may be classified as stable or unstable angina. Stable angina commonly happens during periods of stress or exertion when the heart is working harder and needs more oxygen. It lasts for a few minutes and disappears with rest. Unstable angina, also called rest angina, which can even wake you up from a sound sleep. The pain usually doesn't get better with rest and can worsen with each episode. Diagnosis. The doctor will ask questions about your medical history, do a physical exam, and order routine blood tests. They may include electrocardiogram to monitor the electrical activity generated by the heart at rest and with activity, echocardiogram. An echocardiogram uses sound waves to produce images of the heart. Laboratory tests include a number of blood tests used to diagnose heart disease. Cardiac catheterization and angiogram involve inserting catheters into the blood vessels of the heart in order to view blood flow through the heart. The dye is injected into the arteries of the heart through a long, thin, flexible tube that is threaded through an artery, usually in the leg, to the arteries in the heart. This is known as an angiogram. Stress test. If chest pain or other symptoms occur most often during exercise, doctors may ask you to walk on a treadmill during an ECG. This is known as an exercise stress test. Radiographic tests. These tests use X-ray machines to create pictures of the internal structures of the chest. Heart scan, computerized tomography scan can help to detect plaque deposits in the arteries. Treatment for coronary artery disease usually involves reducing risk factors, making lifestyle changes, and, if necessary, drugs and certain medical procedures. In addition to healthy lifestyle changes, remember the importance of regular medical checkups. Regular follow-ups and prompt treatment for coronary artery disease is important to reduce the risk of a heart attack or stroke. Lifestyle changes. Quit smoking. If you drink alcohol, drink it in moderation. This means up to one drink a day for women of all ages and men older than age 65, and up to two drinks a day for men age 65 and younger. Eat healthy foods. Eat a low fat, low salt diet. Exercise regularly. Check with your doctor before starting an exercise program. Lose excess weight and maintain a healthy weight. Being overweight increases your risk of coronary artery disease. Reduce stress as much as possible. Practice muscle relaxation and deep breathing. Control conditions such as high blood pressure, high cholesterol, and diabetes. Stay physically active. Drugs such as cholesterol modifying medications, calcium channel blockers, nitroglycerin beta blockers, aspirin help improve symptoms of chest pain and prevents obstruction of your coronary arteries. Coronary artery bypass graft surgery. One or more blocked coronary arteries are bypassed by a blood vessel graft to restore normal blood flow to the heart. These grafts usually come from the patient's own arteries and veins located in the chest, arm, or leg. This allows blood to flow around the blocked or narrowed coronary artery. Balloon angioplasty. Balloon angioplasty is a surgical widening of a blocked or narrowed blood vessel or artery by means of a balloon catheter. Several types of balloons or catheters are available to treat the plaque buildup within the vessel wall. A wire with a deflated balloon is passed through the catheter to the narrowed area. The balloon is then inflated, compressing the deposits against artery walls. Angioplasty is often combined with the permanent placement of a small wire mesh tube called a stent to help keep the artery open and decrease its chance of narrowing again. If you have had surgery, participate in cardiac rehabilitation, a program on education, counseling, and exercise designed to help improve your cardiac and overall health. Thank you.